Okay, in today's video we're going to be doing an assessment testing. In the video we're going to be doing blood pressure, skin folds, circumference testing, then we're going to be doing a cardio test, we're going to be doing a strength test and a flexibility test. So, our first test is the blood pressure test. Ask my client to come through. So before we do a testing, we would want our client to fill out a indemnity form and a health and safety form that just gives all the medical history. So in the first test, this is the blood pressure test, the client will sit on a chair with both feet flat on the floor. We're going to ask the client to have their left arm on the table with the palm facing and the hand relaxed. So this is your blood pressure cuff. We will place the blood pressure cuff 2 finger spaces away from the elbow joint in line with the heart. The bladder of the blood pressure cuff will be placed directly above the artery. So here we're going to fix it on the We don't want the cuff to be too tight, as when we start to pump air into it, it might just pop off. So we want to pump air into the cuff at about 160. Just sliding down. Move it back up. Perfect. At about 160, this just, leaves room for error. Then we're going to be taking our stethoscope. We're going to use our middle finger and index finger just to palpate, to feel where the artery is. So just relax your arm. Perfect. So we're going to take the bell of the stethoscope and place it over the artery. There we go. Perfect. Just like that. Then what we do is we pump up to 160 and we open the air valve just to release the air very slowly. So, with blood pressure, we want to have 2 readings. One is systolic and one is diastolic. The systolic reading is the first sound that you hear, or the first tick in the meter over here. Then your diastolic is the last sound that you hear, or sort of a muffled sound. That would be the last heartbeat that you hear. So once we hear the first reading, we need to write it down. This is why I have the notepad. And then we listen for the last reading. So now we've come to 160 and we listen. Perfect. Now that we have our readings, we can write them down. Perfect. Okie dokie. Then the next test we're going to be doing is the YMCA Jackson Pollock Sum of 4 Skin Fold test. So for this test, we're going to need our calipers and a measuring tape. So so we just need our client to stand up. Keep that there. Put the stethoscope down. Okie dokie. So it is important to note that before we do the test that we get the client's permission to touch them so that they're comfortable. So, are you comfortable with me touching you? Perfect. So the first skin fold site is on the back of the tricep. So we just want the client to turn around. And here we need to measure between the shoulder and elbow joint. So we can take our measuring tape. Perfect. So here what we do is we take a vertical skin fold going with the line of the body. So we grab the skin between our thumb and our index finger, like so. We must try to make sure that we don't get any of the muscle. And if you do have any of the muscle, we want to let go, remeasure, and then take the skin fold again. So we just gently rub the skin between the two fingers. Okay, perfect. Then we take our calipers. We place it about 1 centimeter away from where you've grabbed. There we go. We want to try not to let go of the skin until we release the calipers. Perfect. It is important to take the reading twice. So here we go, we take our measuring tape. We have our calipers, grab the skin, rub it gently between the two fingers, and then place 1 to 2 centimeters away from where you have grabbed. Perfect. Okay, the second area is on the stomach, right next to the belly button. So we need our client to face forward. Please can you lift your shirt? So we need to measure about 2.5 centimeters to the right of the belly button. So we got our 2.54 to the right of the belly button. Perfect. Once again, we're going to be doing a vertical fold. So we grab the skin between the two fingers, and we place the calipers 1 to 2 centimeters away from where you have grabbed. Perfect. And then we take our second reading. Okay, so our next skin fold side is on top of the iliac crest. So please can you just fold your pants down a little bit for me? So here we're going to take a diagonal reading. So we find where the iliac crest is, and it would be just above there. So we want to take a diagonal reading of this. So place your calipers, wait for it to sit in. Perfect. And then we do our second reading. Okay, then our fourth site is on the thigh. So we want our client to stand on their left leg with most of the weight on the left leg, the right leg being relaxed. So here what we're going to do is we're going to measure the site from the in line with the groin to top of the knee. Okay, straighten your leg for me. Perfect. Once again, we're going to be taking a vertical fold. Okay, then our second reading. So now we come to our second test, and this is where we test circumference. So our first circumference is of our upper arm. It's a relaxed upper arm, so we're just going to get the client to turn to the side. Perfect. So what we want here is just a relaxed, nice arm, and we're going to be taking the stub of the measuring tape around the arm, through the back of the arm. There, you can put your arm down for me. And we don't want the tape to be making any indentations in the skin. We just want it to be tight enough to give us a true reading. And we're going to write that down. Perfect. And then we're going to be doing the thigh. So we need to kneel down in front of the client. Make sure the client is facing us, so please can you turn towards me. Perfect. Then we take the stud through the back of the leg. And then our last reading is the calves. So we want to place our leg onto a chair at 90 degrees. So please place the leg on the chair. You can place your right leg for me. Perfect. No? With your foot up like that. Perfect. So here we're going to be measuring at the largest circumference of the calf muscle. And we're going to be doing it at 90 degrees at the body. Perfect. So our next test is the step test. We will be going outside.